there. How are you? Welcome. Happy half hour to you. Here's a toast to all of you. Thank you for joining us. And my name is Susy Schultz. I'm the executive director of the Museum of Broadcast Communications here in Chicago. I love those. Can I do that one more time? These are old original NBC chimes. It's one of the wonderful artifacts that we have at the museum. We have a lot of artifacts at the museum, and we're hoping that at some point you're going to come and you're going to see it when we're all safe and we'll all be able to be together again on the other end of this quarantine COVID-19. I'd like to call it an adventure that we're on, but that sounds exciting and not as desperate and life-threatening as we all know it is. But I want to talk to you a little bit before we have a guest today. We're going to talk about COVID-19. We're actually going to talk about coverage of COVID-19. We're going to talk about the message and how it gets out to people on digital platforms, because as the Museum of Broadcast Communication, not only do we cover radio and TV, we also talk about digital broadcasting and its impact on people. And so one of the things that we have put together, hopefully to help all of the teachers and parents who are going back to school, teachers of middle schoolers, teachers of high schoolers, is a program that we call the Great Debates. In fact, you can find it on our website or at greatdebates.org, greatdebates.org. And what we're looking at is actually the long-term effect of broadcast, the three different industries, whether it's radio, whether it's television, whether it's digital, and the effect it has had on the presidential election. We're seeing it now more than ever, especially in digital. The whole campaign is digital. If we watched any of the conventions just recently, we know we're getting it all in our home, we're getting it all in our computer, either television or streaming. And so it's a time where this type of communication is really crucial. And we have not only in there a 100-year timeline of all of the time that broadcast has iterated and evolved, and how that has caused disruption within the presidential campaign and caused people to react in a totally different way. We also have 9 different modules for curriculum that can be overlaid on the core curriculum. You teachers out there, you know exactly what I'm talking about. But we hope you take a look at it, whether you are an educator, whether you are a lifelong learner yourself. Go to greatdebates.org and we will meet you there. Now, today, I'm very happy to be talking to Dr. Emily Landon. Dr. Landon, how are you?
I'm good. How are you?
Good, 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 good. I'm happy to say that I'm good. That's a good thing to say these days, right? Dr. Landon is a chief healthcare epidemiologist at the University of Chicago, and you may have seen Dr. Landon on some of the governor's press conferences. She's talking often about the public health background on this and what's really important. And I think what has always appealed to me, I think the governor brings together a group of amazing people. I think Chicago and Illinois have wonderful public health people. But what has just impressed me about Dr. Emily is the way that she speaks so humanly, speaks as a parent, and speaks as a public health official and a person actually enduring the pandemic herself. And you are, we call you the mask lady
Oh,
behind you.
well, I'm thrilled to be known as the mask lady because it is one of the most important things that we can all do to help protect ourselves during this pandemic and to help others around us. And that's really the goal of most of my communication. That was a very kind introduction.
Well, no, it's a very true introduction. I think I told you we've developed a little fan organization for you at the museum with some of the senior staff because we love when you're on. Actually, we watch a lot of the news conferences because we think it's just a really important. It's how we're getting our information now, and most of us are getting it on computer or on phone. Some are getting it on television, but so being able to speak to people directly and to make us feel as though we can be part of the solution instead of you are the experts talking down to us. That's a gift. That is, and you have that ability to
Well,
to
thank you
really
very
talk.
much.
You are so welcome. Tell me a little bit about how you. I know that your profession automatically, and the direction in your profession automatically includes you in this. But how did you get tapped to be part of this team? To be somebody who is speaking to all of us?
Well, I'll start by saying that I have a background in some public speaking, but not an important background. Just a lot of sort of speech team, that sort of thing, when I was in high school and a little bit in undergrad. And that's a really good foundation for people who are growing up and they want to be able to excel in this sort of work. It's really important to have a background from a young age of being comfortable talking to people. And that really helps in medicine as well, in talking to patients and talking to families. So that's where that all started. But really, I think my experience in the media started many years ago when we had the Ebola outbreak. And I was asked to make some comments for a couple of different news organizations. And at the time, I hadn't done any media training or had any real experience in that work. But as I put it, I didn't do a bad job. And so I was asked to talk again and again. Um, and since then, I've had a little bit more media training. But really, you know, I, I try to talk to cameras the same way that I talk to human beings. And I find it actually even easier to do it over these video conferences like what we're doing now, because you really are, I have someone I can talk to. It's not a blank screen. It's a little
Mhm.
easier than being in a studio with, I don't know if anybody's ever actually been in one of those studios, been a talking head on one of those news programs, but you are, in my experience, in a studio that's often soundproofed, very dark, with a bright light in your eyes, and you don't see what's happening on the screen. You just have a little thing in your ear. So you feel like you're kind of in a void and just speaking into the void. So it feels a bit like being a real talking head. And I much prefer this, being able to see people two ways via video screen. So this actually makes it a lot easier.
Well, so tell me a little bit about is it fair to say that you are part of the medical team that's advising the state and the city? Is that accurate?
Yeah, yeah, I think so. So, I think more specifically about this, the governor was reaching out to actually everyone that does my kind of job, a hospital epidemiology job. Every major hospital has one. Every smaller hospital has a team of infection preventionists that's often led by an infectious diseases physician. And he was reaching out to these kinds of individuals at all of the main hospitals in Illinois, not just the ones in Chicago, but ones across the whole state. And
Can I
we
stop you?
all,
Can I stop you 1 minute?
sure.
Because most people know infectious diseases is pretty obvious, but can you tell people exactly what an epidemiologist does?
Yeah, so the role, now everybody knows the role of public health in the community, trying to make recommendations and rules and guidelines that help keep the public safe, sort of proactively communicating those rules and getting people on board, and also serving in to some degree as watching over things and figuring out where things are going wrong and intervening to try and solve those problems. So we do the same thing inside the hospital. The hospital is a different environment than the community because there are a lot of very vulnerable patients. There's a lot of staff that have to take care of them. This is not the first, nor will it be the last infectious disease that our staff is at risk of catching from a patient or transmitting from patient to patient or from themselves to a patient. And so we have a lot of hospital epidemiologists are responsible for the team of people, the infection preventionists, who make sure that things are not spreading in hospitals. We also work hard to prevent healthcare associated infections, which, if you remember pre-pandemic, were often in the news as causing problems in hospitalized patients. That's when you go into the hospital for one thing, but you get sicker, catch something in the hospital, and come out with or end up with something even worse. And it's our charge to stop that from happening and to prevent it whenever possible.
Yeah. And so it's its own lane within the medical structure to
Yeah, we
actually be
work
looked.
Yeah, I'm sorry. We work with all of the areas of the hospital. So we work in pediatrics, we work in surgery, we work in obstetrics, we work in adult medicine, we work in oncology. We work with all of the providers in every single area for their unique needs about how to prevent any untoward infectious complication or problem that may spread from person to person. Every year during flu season, we do a mini version of what we're doing for COVID 19, and I
Mhm.
mean really mini. It's much, much easier to manage influenza. But that's the sort of work that we do within the hospital. And then oftentimes when things are big infectious disease, sort of society issues, we are often called upon to help with public health activities. And we have a very close connection to our public health, our
Right.
local public health office and the state public health office. And so we often step in and help. I mean, they do not need us to advise them. They are doing a wonderful job, but certainly we can help spread messages and be experts and help advise things. And so when the governor wanted help from others that weren't just his little, not little, but his state public health team, he wanted to hear from people who were not appointed, who were not part of the government, who could speak without any bias, but just from a healthcare standpoint, not from a Republican or a Democrat standpoint. And he reached out to all of us. And then I don't know why he thought I would be the best person to speak about the stay-at-home order, but I was very happy to be able to do so.
Well, you have done a wonderful job from my observations, and I only push back with you on the assertion that those in public health don't need your advising. I think in public health, one of the wonderful things about it is there's a recognition that you need everyone at the table, and you need all
Yeah.
those voices to actually make it effective. And so, public health is about bringing people together. It is about making sure that I get advice from you, I get advice from you, I get advice from everyone, because there is a wealth of different communities that have to be communicated to. And what we do know in terms of communication is that even though we all speak English, we all speak different languages within our communities, and that's a code switch, a vernacular, or whatever it is. And sometimes culturally, we hear one thing when somebody is intending another thing. And so, getting all those voices at a table helps us craft messages that people will actually. So,
Yeah.
I'm glad.
Well,
Hey,
we're talking over each other. I'm so sorry. In order to be able to be effective in communicating health needs to the community, you have to understand where all sorts of people are coming from. And it's just as important to listen as it is to speak. And so, I agree with you. Public health does need all sorts of advice and wants to bring people to the table. Um, but I think it's also, what's been successful for me is hearing what my team says about what's happening in the hospital, but also listening to what the nurses on the front line say, what the doctors on the front line say, listening to what the patients say when they are given they're not always given as much of an opportunity to speak. And so it's really important to listen to them. Also listening to what my colleagues are saying at other institutions and what families are saying, and honestly what reporters are asking me about when they call me. That gives me a pretty good indication. I think actually what they've been asking has been pretty reflective of what people are thinking about. And I know that's a chicken or egg problem because they're writing the stories, so maybe that's what's spurring people to think about it. But I think they've been right on about the things that I think are important for people to be considering and thinking about, and we can work together to get the message out.
so what I love about your message is that you're basically saying there are simple steps that we can all do to help with this, to move this in line. And what I'm curious is there's a disconnect. I mean, the simple steps first are what? I want you to repeat it, even though you've repeated
Yeah,
it so many times, because it bears
happy to.
repeating.
As an aside, when I'm not doing a lot of media work around a pandemic and dealing with this sort of thing, I actually study healthcare provider behavior with respect to habits. And I use hand hygiene as a model for understanding how to change habitual behavior in the hospital. And that really has informed a lot of how I communicate about the habits that we need to change in order to make it through this pandemic. Because really, what's tough about this is that we have to lose something about our daily lives. And
Right.
changing our habits is just another indication of what we've lost. And getting past that loss and then also changing our habits is hard for people. And we have to
Very.
acknowledge that and still do it. So the major things that have to happen, we need, of course we need a vaccine. Of course we need a sort of a more coordinated testing program across the country. But I agree with what Dr. Burke said yesterday, that we can absolutely stop this virus by changing our behavior. What I think it's hard for her to acknowledge is that it's really hard to change our behavior. So we have to just keep saying it over and over again. And those things are the 3 W's, really. Watch your distance, wear a mask, and wash your hands. And I would add a couple of other things, which would be that are sort of secondary but also important. Don't go to work when you're sick. Make sure you get tested. make sure that you're being careful about masking, especially and the masking. There's a lot of sort of detail about masking and specific knowledge about ventilation and different kinds of masks and different things that are really sort of high level information for your average person or even your average healthcare provider that
Right.
we need to communicate those to people well so that they understand how to protect themselves when they need to.
So why are we so bad at this? We,
Because it's
we
hard to change our habits. It's
yeah.
the same reason that it's hard for people to lose weight, that it's hard to quit smoking. It's all the same. It is you know, it's about changing our behavior, and no one wants to have to change their behavior. There's a lot of sort of personal comfort in doing things the same way all the time. We may not realize that we have these routines, but they are literally brain shortcuts. You don't have to think when I'm sure you've had this experience where you're driving home from work and you are supposed to stop, you mean to stop at the store, but you're thinking about something else, and so you just drive home. And you
Right.
think, "Oh, why didn't I go to the store?" Because you have this shortcut in your brain, this habit of driving home. And we have shortcuts in our brain for walking out the door, not carrying a mask with us. And we have shortcuts for hanging out with people at restaurants. And these are things that are just part of our lives. And we have to change all of that. It's much, much harder to change all of that than it is to get people to do one thing one time. And that's why it's so hard. The stay-at-home order, the initial stay-at-home order, much easier to encourage people to do because it sounds like it's one thing one time. What is
Right.
much harder is the rest of this change.
My husband and I went to an event a couple weeks ago, just a backyard party, and since the hostess was a nurse, I felt very confident walking in there in my mask. And there's somewhere in the neighborhood of 40, 45 people, and I was the only one with a mask on. And I didn't I didn't I just it just hit me right in the chest. If it's hard to appeal to a group such as this, where more than half of them were healthcare people, um um I mean, what chance do we have in the in the and are we is it safe to say that we are not doing near as well as we could with that change of habit?
In Chicago, we're actually doing better than a lot of other places are. Now, we're not doing well enough. No one is. But we also need to, there's a lot of, there's a lot of nuance to this that has to be sort of understood and internalized about, is it okay, we have gatherings are allowed up to 50 people, and a lot of people interpret that as gatherings are safe up to 50 people, and that's not the
Right.
same thing. They're allowed. There are still, you still need to take safety precautions if you're going to participate in that. And I actually, given the positivity rate in Chicago and in the state of Illinois right now, but specifically in Chicago, gatherings probably should not be 50 people. I think
So
at this point,
how are we doing right now? How are we doing in Illinois and Chicago?
Chicago's doing better than much of the rest of Illinois, but Chicago's not doing awesome. So the numbers, the average daily case totals in Chicago are around 350 right now. And and as we have a case positivity rate, so it's test positivity rate of about 5%. And that's really a turning point. Above 5% is a lot worse. That means a lot more people in the community, a lot more contacts have COVID. So imagine what five, and that test positivity isn't really the community prevalence, so the number of people, because more, there's a higher percentage of people that will be positive amongst those who are taking tests than just the general population. But they're correlated. In other words, if 5% of people getting tests are positive, then that means that probably a certain percentage of the community is infected. And it's probably half that, maybe less than that. It's hard to know because we don't do large
Okay,
sort of
so we're
testing
getting a little bit, just so you know, we're getting a
in the
little bit in the
weeds.
weeds here. So I'm gonna take us out of the weeds. I'm gonna say, beside, what should we um, be looking for? Who should we be listening to? Where should we be getting our information? Too much of it us get information curated by our friends, passed along by Facebook. Where should we be looking for our information
Well,
online?
I wouldn't look on Facebook or Twitter unless you know exactly who you're following. I like Twitter because I can follow with other physicians that I know in real life and I trust them, but I don't follow people that I don't know in real life. And a lot of what we get off of Twitter and Facebook, unless you know a lot of doctors, you're not going to be sure that the doctor that you're listening to is really a doctor or is really understanding the situation. So I think that's probably not the right place to go. Most of the mainstream media, and by mainstream media, I'm talking about things like New York Times, Washington Post, Tribune, Sun Times here, are really trying to get it right. And they're trying not to spin it any one direction or another. And I've been pretty happy with the coverage. Now, sometimes that coverage is a bit on the more salacious side. I think that if you only look at the headline, you're not going to walk away with the right information. But if you read the whole story, what's in there, they're going to write the headline to get views, right? So they write the headline to get people to click on it, but you have to read the story that's written in order to understand what that means, right? And so I think that's probably where I would look. But the public health websites for the city of Chicago and the state of Illinois are the place to go if you really want the information. Those briefings with the governor really are very well balanced and giving they're sort of focused on giving the right information. And I have to say, I've been super impressed. Every time I've given remarks at one of those meetings, I've said, well, what did you want me to talk about? And they say, whatever you think is important, you do it. We're not editing anything. You say what you want to say. It's your platform,
So
which is great.
it is great. It is great. But we have this overlay of the polarization of our political experience right now, and we have a president who's saying that the Democratic governors, which of course that would be our governor, Governor Pritzker, are getting it all wrong, are not doing well. Our Democratic mayors, and in Chicago, that of course would be Mayor Lightfoot, are getting it wrong or not. And we see that there's a politicalization of the information on the CDC. So when we are looking at it from outside as an audience, the public health audience who needs this information desperately, how do we make sure that we are able to get around um, anybody who might have a political bent on moving us in one direction or another? How do we do that? How do we sort through that?
I think that there's a lot of accusations of politicization flying around. I think that that's I agree that the CDC is having some issues with politicization. What I look for in that is I want to see why they're making the recommendations they're making. How do they justify it using evidence and science in the background? And if you read things, this is not going to be good for everybody to do, but I read things like the footnotes and the references to see whether or not there's backup for what they're saying. And then I only repeat or use the things that have backup references and science behind them. But how do you know who's doing that and who's just making stuff up? That's a really tough one. I do want to point out that I think the president, and this is not a political statement, the president seems to be in a little bit of denial. And I think there are a lot of Americans in a little bit of denial. That I think we've all heard of the stages of grief from Elizabeth Kubler-Ross: denial, bargaining, anger, depression, and then acceptance. Those have been regularly applied to the process of change. And they hold up in lots of studies that they really do apply to change. And if you take honest stock of your own feelings and of the person who's talking and where you are with this, do you find yourself wanting to be in denial? Because that's normal. It's okay to want to be in denial, to gravitate toward other people that want to be in denial. But you have to understand that that's just part of a process. It's not a place to stay. If you feel like you're in denial and you need to be in denial for a little bit, be in denial for a little bit. But you have to also acknowledge that you're going to have to move on. And sometimes you'll feel angry and sometimes you'll want to bargain. But I don't have to wear a mask if I'm going to be 6 feet apart from someone inside. And I'll bargain right back. But we don't know what the ventilation is going to do inside. And if that other person doesn't have a mask on, you could still be at risk. But there's no need to stay in these states. Once we get past denial, bargaining, anger, and depression, we can get to a place that's acceptance, where we say, well, like, okay, I guess I can do most of what I want to do. I just need to make this sacrifice of wearing a mask. And not going to be able to have big events until we get this under control. So it's kind of worth it to me to wear the mask and get things under control. That's where we want people to be. I would argue that our president is not there. And I think you can say that. I think you can tell that by the rhetoric that he's using and the way he's talking about things. Um, but you can
Well,
also look around and see that that's not the reality of the situation in the hospitals and in the look just look at the numbers. The numbers speak for themselves.
so I think what's also important when we talk about news and at the museum, we talk a lot about media literacy. You
Yeah.
also, when you're looking at stories, you're looking for who the sources are. If somebody is just quoting generalities and there are no names attached to them, no titles, then you pretty much should not be using that as a source. There has to be attribution. There has to be
Yeah,
a name attached to it.
this
So that's one of the things. And also you don't want a story that has just one source to it,
yeah.
if that makes any sense. You want to see
But
somebody done their due diligence.
one thing
Yes.
that's so hard right now is that the CDC has been widely respected across the world for
Yeah.
their sort of um, ability to stick with science and make good recommendations in difficult situations. And I will tell you, I don't think that they're doing that. And I can see the science and understand the science. There are some of their recommendations are great, they're really backed up, they're really good, and others are clearly a departure from that. And so you can't even, it's hard for the layperson to understand that you can't necessarily trust what the CDC says. And I think I'm seeing signs that the FDA is showing some political bias as well. There's no way in the past that the FDA would provide an emergency use authorization before the completion of even a phase 3 clinical trial. And so, why would they say that they would do that for a vaccine now? It's just not consistent with science and it's not backed up. So, you've got to look at the history and you've got to ask someone, you've got to know from somebody that you trust. And I hope that I just try and be a voice of someone who's trustworthy. It's the best I can do.
Well, and I think that I know you are, and I really appreciate that. I think that your voice does, along with many of the voices that I'm hearing from Illinois and from Chicago, they do seem to smack of we're looking at science. I think the only thing I would say, because I think we're definitely coming to the end of our happy half hour, even though at moments here I have to say we haven't been as happy as we could be. It's not a happy subject, but I think that your message is clear that this is not easy. And if we are looking for somebody to hand us an easy way out, perhaps we're looking in the wrong direction. It's going to take work on all of our part. It's going to take I have to say, I'm not particularly fond of wearing a mask. It's not anything that I love to do, but I would no sooner go out of the house without my mask than I would go out, totally naked. It's just not at this moment in time, it is not an option. And I love the way you talk about the bargaining part of it, because we
Hmm.
do had this in my own family. Well, if we just did this and we did this, wouldn't it be okay? And wouldn't it be and when we start down that road, I think we also have to stop ourselves and say, no, this is what, remember what Dr. Emily said. Dr. Emily said the W's. And let's close with just the W's as well.
Yeah, really briefly, I want to say that if anybody's offering you an easy way out of this, they're selling you snake oil. So don't buy it. There's no easy way to get through this. You're going to have to make it through the habits. And those are wear a mask, watch your distance, especially inside. It's not masks or distance, it's masks and distance.
Right.
Outside, I'm good with you not wearing masks 6 feet apart, but inside, it's got to be both. It's got to be both. Please make sure you do that. That's how we're going to protect ourselves in the winter. And the last one, wash your hands, and along with that, wash surfaces and shared surfaces, and wash your hands. Keep your hands clean, keep surfaces clean, keep that mask on your face. I know it's uncomfortable, but as
Yeah.
I learned my very first time in an 8-hour surgery as a third-year medical student, I made it through that, even though I was like, oh my God, I'm going to suffocate in this mask. You will get used to it.
You will. You will. Thank you so much. Thank you for continuing to be a voice. Thank you for your information. And thank you for bringing humanity to all this as well. And thank you all for joining us in Happy Half Hour. We hope to see you here next week, where we will be talking about something as interesting to you, to us, and maybe pertinent to the whole world. Who knows? Have many happy half hours until then.